Welcome to the Sarah Finkelstein Show. Today's topic, we're going to cover the differences between Medicare Supplement Plan G and Medicare Supplement Plan N. Which is better? And today is January 31, 2022. It is the very last day of this first month of this new year. So stay tuned. We're going to share lots of valuable information with you. Before I begin going into the differences between the two supplement plans, we do have to have a conversation about Medicare. What is Medicare and what is original Medicare? So original Medicare consists of Medicare Part A and Medicare Part B. Now, Medicare Part A is the hospital portion of the health coverage. It covers your hospitalization. It covers skilled nursing facility. It covers hospice care and some home health care. Now, Medicare Part B, as in boy, covers doctor visits, outpatient procedures, preventive services, and so much more that we're going to delve into. There are costs affiliated with Medicare Part A. Now, most people do not pay a premium for Medicare Part A because we pay into the system during our working years through payroll deductions. But once we go on Medicare, there are costs involved other than a monthly premium for Medicare Part A. So, for example, when you get admitted into the hospital, there is a deductible for the benefit period, and they count the benefit period as a 60-day period. So whether you're admitted into the hospital for one night or you're admitted into the hospital for a full 60 days, you have a deductible. And that deductible increases from one year to the next. The deductible this year in 2022 is $1,556. Now that deductible could happen actually several times throughout the year. In other words, it's not an annual deductible, it's a benefit period deductible. So if you're in the hospital for 1 week and you go home, and then 3 months later you end up in the hospital, you have that deductible again. Then there are co-pays. So the benefit period again is 60 days. Most people don't stay in the hospital for that long, but there are still situations where that can happen, and it does happen. From days 61 through 90, you do have a daily copay, which is $389 per day. If you still need to be in the hospital beyond that, from days 91 to 150, that daily copayment is $778. So if you're in the hospital for 150 days, you've got your deductible of $1,556. You've got your daily copays of $389 from days 61 to 90, which equals $11,670. And then you've got your daily copay from days 91 to 150 of $778 per day, and that equals a whopping $46,680. Ouch. It can be very expensive unless you protect yourself. Now, skilled nursing, if you need to go into skilled nursing, as long as you've been in the hospital for at least 3 days before you're admitted into the skilled nursing facility, Medicare will cover the first 20 days. But if you need to be in the skilled nursing facility beyond 20 days, from days 21 to 100, your daily copay is $194.50. And that would equal $15,560. Under Part A, hospice is covered, and they consider hospice terminal illness as 6 months or less to live. Blood is you're responsible for the first 3 pints of blood. And the supplement plan will pay all of that for you. So once you sign up for supplement plan G or supplement plan N, both of those will pay all of the copays, all of those figures that we just went over. Let's talk about Medicare Part B as in boy. And I always like to say, think of Medicare Part B as basically anything that happens outside of the hospital. Your doctor visits, your outpatient procedures, your preventive services like the flu shot, the ambulance, your occupational therapy, physical therapy, and lab work. Need to get to my next slide. Cancer screenings and chemotherapy, your diabetic screenings and supplies, of course, durable medical equipment. That would be walkers and canes and oxygen, limited chiropractic vision and hearing, occupational therapy, physical therapy, speech therapy, and of course, blood work. And then we have diagnostic tests and a lot more. So Medicare Part B covers a whole bunch of stuff. So let's talk about the supplement plans. Now, original Medicare, which consists of Medicare Part A and Part B, allows you to go to any provider anywhere in the nation. There's no networks and there's no referrals when you have access to original Medicare. Supplement Plan G happens to be one of the most popular plans today because it is the most comprehensive. And, you know, when we sign up for the most comprehensive, our premiums are going to be higher than another plan that is not as comprehensive. So we're going to be talking a little bit more about the differences between Plan G and Plan N. So it's very important to stress and emphasize that when you are on original Medicare and you opt for a Medicare supplement plan, which is also known as a Medigap policy, your plan is what's called guaranteed renewable, meaning that you can keep your plan forever. As long as you pay your premiums on time, they can never cancel you. And you get to choose any doctor, any hospital, any provider, anywhere across the country. That's the beauty of having original Medicare and the coordinating supplement plan. So the differences between a supplement plan G, which is the most comprehensive, the only thing that you would have to pay under Medicare Part B is the annual deductible. So there is an annual deductible under Medicare Part B as in boy, and that is currently $233. So when you're on Supplement Plan G, you'll pay your monthly premiums, and once you meet that Part B deductible annually, one time in the year, you don't pay anything else. The supplement plan pays everything on your behalf. With Plan N, now remember, Plan N is not as comprehensive as Plan G. Therefore, the premiums are lower. And you know, when you opt for an insurance product where the premiums are lower, you know that you have a little bit more cost sharing than with a product that has a higher premium. So with Plan N, here's what happens with Plan N. You still have to pay the Part B annual deductible of $233. There is also a $20 office visit, and there's a $50 emergency room copay, which of course is waived if you end up getting admitted into the hospital. Now, under original Medicare, doctors can add on something called excess charges. So under Medicare Part B, you have the annual deductible of $233. You have coinsurance of 20%. In other words, Medicare will pay 80% of the approved amount. You'll pay the 20%, that's called coinsurance, but there's something else called excess charges. So not many doctors do it. I would say most doctors do not. But some doctors do add on what's called excess charges, which is an extra 15% on top of what Medicare approves. And there's a few states across the country that don't allow this at all, but many states do. So it's up to the doctor whether or not they add on the excess charges. So if you opt for Plan G, it will cover the excess charges for you. But if you opt for Plan N, then you have to pay those excess charges if your doctor does add them. In summary, Plan G has a higher premium, but less cost sharing, whereas Plan N has a lower monthly premium, but you're going to have the $20 office visit copay, the $50 copay for the emergency room, and you'll be on the line for those excess charges. A lot of people think that they could switch from one plan to another during the annual enrollment period. So let me just backtrack for a moment and talk about the annual enrollment period. That happens every October 15 to December 7, and that applies to people that are on a Medicare Advantage plan and people that are on a standalone drug plan. They can make changes. But the annual enrollment period does not apply to Medicare supplement plans. Now, you could switch from one carrier to another any time of the year. However, you will have to answer the health questions. So this is how it works. When you first become eligible for Medicare, which is at age 65, you have a 6-month window within which you can apply for a Medicare supplement plan, and you do not have to answer any of the health questions. But beyond that 6-month period, then you would have to answer the health questions. So for example, if your birthday is in July and you turn 65 July 15 as an example, your Medicare eligibility date is July 1. So you have 6 months. Let's say you sign up for a supplement plan in July and you have an effective date of July 1. You could switch to a different carrier within that first 6 months. So you could switch August, September, October, November, December. But come January, if you did want to switch, then you have to answer a bunch of health questions, which means you may or may not be able to switch. Now, why would anybody want to switch? Well, if they move from one state to another and maybe the carrier that they currently signed up with is not as competitive in their new home state, that might be a reason to switch. Or if you get a really huge rate increase, you may want to look around and see if you could save some money. And by the way, we shop the carriers for you so that we get you the best rate in your area. So if you have any questions, feel free to reach out to me. I'm more than happy to answer them. Thank you for joining the Sarah Finkelstein Show. and we look forward to seeing you tomorrow.